Hi, it's Angelique from Tambarcus Physiotherapy. We're a family-centered clinic run by myself and my husband, Harris. We support parents to move better, feel stronger, and care for their families with confidence. Because when you're well, your whole family benefits.
Hello, and welcome to Wine with Wita, the podcast that is dedicated to engaging with health professionals and caregivers in meaningful discussions. I'm your host, Rita Shamoon, or as my clients call me, Wita. I'm a paediatric speech pathologist, and I am so excited to have you here. Each week, we deep dive into connecting you with caregivers and healthcare professionals, sharing their insights, stories, and key takeaways to help you with your child's diagnosis and your journey. Whether you are a parent, healthcare professional, a lifetime learner, or simply a wine enthusiast, you're in the right place. So let's sit back and relax and enjoy today's episode. Hello, everyone. Welcome to another episode of Wine with Wita. Today, I have a highly respected health professional, actually a doctor, on the podcast who will make you start to question things in a different way and open up your mind to a different understanding of pediatric development and possibly be the puzzle to your mystery piece for your child. So I am graced with Dr. Carlo Rinaudo, chiropractor and clinical director of Brain Hub and Brain Hub Kids. Welcome to Wine with Wita, Dr. Carlo.
Thank you so much, Rita, for the invitation. Love to be here.
Thank you for coming on this evening. Now, as a speech pathologist, I've worked with so many children for over 15 years. And over the last, I would say, 5 to 6 years, the concept of chiropractors have been in my initial consultations, and it's made me question, what do chiropractors do for children?
That's a great question. The premise of chiropractic goes back many years, many decades, in fact, and it's centered around the premise of a healthy nervous system equates to a healthy human being. And the premise that there can be interference with the nervous system and that interference can come from abnormal joint mechanics, abnormal nerve function, and the elimination or the removal of this interference, I guess, is the premise of what many chiropractors do in a more traditional sense. Those that work in the pediatric space, I guess, look at it from a very age-appropriate manner as well. I know we associate chiropractic with the manipulation and the thrusting and all the pop and cracks that go with it. And the fact is that particularly in the pediatric space, that's far from the truth. There are much more mild, gentle, pressure-based release type of treatments, whether it be cranial, which is working on the head or the jaw or the upper neck or the tailbone area. Invariably it's typically an age-appropriate, force-appropriate type of therapy that is really aimed at improving that connection between brain and body. And that's a very basic premise of what a more standard chiropractor would do when working with children.
What made you go into the neurorehabilitation scope in your industry?
Wow, that's a great question. I've been in practice now for 25 years, and I said it the other day, and it was a scary thought. Having a team of team members in our office that are only been out for several years, up to 10 years, and I said that I've been out for 25 years. It sounded quite abnormal. I guess 20 years ago, when I left university, I've always had the thirst to understand why. Why does something work? And I was firsthand saw the benefit of chiropractic for many patients, and I couldn't quite understand how that could be that I could put my hand on someone's back, do some work on their spinal joints, and they would improve it at many levels, not just their back pain or joint pain or whatever it might be, but their brain fog would lift, they would sleep better, their memory would improve, their mood would improve, and we and this is again the premise of many chiropractors. We would see this, but unlike others, I guess I didn't take it as well. It just happened, and that's what it is. I wanted to know more. And when you look at the common thread between many modalities, whether it be speech pathology, whether it be occupational therapy, behavioral optometry, or whatever it might be, the common thread to this is the brain. We all affect the brain and try to understand how the brain is interacting with the body and the world around us. And so I thought, well, there's got to be more to this. So I started my journey in clinical neuroscience, completed some postgraduate work in that area, and then again, my thirst for knowledge in that grew a little bit more, and then I started to teach the same coursework to a growing audience. And once you become a teacher, you really start to master the information. And then I started to present at some seminars, and rightly so, my reputation and I guess my credentials came under the spotlight when I was sharing the stage with many esteemed professors and researchers. And again, so the next thing is, well, I need to meet that, and I embarked on a research project, a PhD, and so that became again engrossed in the clinical neuroscience aspect. So I love the brain. I love how also love how we don't know much about it. To be fair, I love how we can have greater certainty in what we do with patients if we have a better understanding of the neurology of what connects one area of the body to another. And the more certainty you have, the more understanding you have in that connection, generally the results become more predictable rather than, it just happened and it wasn't that a fluke. It becomes more predictable. And I think as over time, I think I'm starting to get a little better at that skill of having more predictability, but it comes down to an understanding of the neuroscience, pulling together different disciplines from the different forms of allied therapy to neurology to functional medicine and clinical research, and pulling it together and then coming up with a secret herbs and spice that works for the individual is quite fun to do.
Yeah. I like how you said working with a range of allied health professionals, because it's so important to respect every discipline and know what they do to support, say, a child's overall development. But sometimes as a speech pathologist, I feel quite confused because I'm at a block with some clients. It's like, okay, what allied health do I need to refer on to further to support a child's development? And it could be occupational therapy, physio, or even chiropractors here. And it's so, I believe, refreshing to know what you may offer for our clients as well. What are the main reasons that you find in your clinical space to children coming to see you?
I would
Or the
say
common ones, actually?
we just did a survey, a big patient evaluation survey in our office, and part of that was looking at the demographics as to why patients come to us, what age group. And interesting that the dominant age group was the 5 to 6 year olds. And when we look at the conditions in which they present to us, again, the data was there, which was really good to see. Most of them were for neurodevelopmental concerns. And they range from, ASD to ADHD to sensory processing. We do see a number of kids with more complex conditions like cerebral palsy, seizures, hematomas, or birth-related injuries, and genetic disorders as well. Again, we were able to look at that data a little closer, and what we found is about 50% of the kids that we see are typically those that would be now described on the scale system as an ASD2 or ASD3, and almost all of them are nonverbal. So we do see, I would say, a fairly unique a cohort of kids, at least within the chiropractic sort of allied health space. I'm sure, Rita, you would see similar kids as well, but that's typically the child that we see. Those that are either about to embark on kindergarten or have just started,
Yeah.
and parents are realizing, oh dear, my little daughter or son is not quite where they need to be,
Yeah.
and we need to accelerate this change or get them school ready before they commence, or when they have started, the teachers have identified to them, your son or your daughter is, we're finding some challenges here in the classroom, and then that's when they reach out and look for some assistance. And typically when they come to see us, they have a team of allied therapists that they're normally working with. Speech pathology and OT would probably be the most common.
Yeah.
ABA therapist, physio, chiro, functional medicine practitioners, if they've gone down that path of nutritional and metabolic work. So that's sort of the typical child that we would see in our office.
Yeah. You mentioned parents coming to see you around the 5 to 6 years of age. Would you suggest, if a parent's concerned, to come at that age range, or would, like with any other health professional, focus on the early intervention element?
Look, I think early intervention is always best.
Yeah.
Whilst sometimes diagnosis, which many parents come in with, may not be forthcoming until a bit of a later age. But if you go back through a patient's history, parents are quite quick to identify, generally at a young age. It might be 12 months, it might be 18 months, when they start to see a discrepancy in either other children they have, or other children, family, friends, or relatives that are aged similar, and they start to see differences. My strong suggestion would be at an early sign, at an early stage, if there are signs that do appear to be tracking outside of the normal range, then it is certainly worthwhile to present to a primary care practitioner. For many, it would be a GP or a paediatrician,
Okay.
which that has its strengths, and there is also some shortcomings there. But also a team of allied therapists that deal with these with kids with special needs, I think would also be, because a lens of a parent, whilst they can be very acutely aware of the subtle differences, but if it's a first child or an only child, and we've gone through COVID, we don't have great comparisons to make sometimes. Parents could be 1, 2, 3 years with a child, and they've missed those initial years of identifying early concerns, and then it's never too late. And that's something that I have many parents that are very harsh on themselves, wishing they came in
Yeah.
earlier, and they go, damn, I wish I came in earlier, but it's not the time for it. But certainly making some early inquiries, maybe with a range of different people who have expertise or look through a certain lens when it comes to childhood development, is a valuable point. We often look at milestones as an indicator to say that something is normal or outside of normal. And historically we've looked at crawling, or walking, or first words, or answering to names, or whatever it might be as indicators. That's shifted a little bit, unfortunately, with, at least in the US, with the CDC, the Center for Disease Control, shifting the ages at which these milestones should appear or disappear is concerning.
Really?
A couple of years ago, they shifted. Let's say the average age of crawling is, say, between 6 months and 9 months. Let's just say. Well, they shifted that by about 3 to 6 months. Now,
as in earlier or later?
Later.
Oh.
The reason for that was, as well, so many kids now are crawling later, so we just have to shift the guidelines, but that's not the best way to do it. We shouldn't.
No, you shouldn't.
I don't think we should. I definitely don't think we should. I think they're doing it because, well, there are so many kids that now crawl and walk and develop at a delayed level. let's just shift the goalpost now to be more in line with that, rather than identifying that these kids are actually falling outside of the normal range,
Yeah.
and we should do something about it. They've just shifted the goal. So there's a bit of mixed messages in them, and I don't know what the Australian version of that is, but I think it would model something like the CDC. Um,
Yeah.
so
Sorry to interrupt you. I guess that confuses the whole concept of typically developing, right? And milestones and goals to target. But then that also shifts the concept of early intervention and starting earlier. It's like, well, if we're changing the developmental norms for crawling, we don't have to start till later, which is like, well, is that the best decision for the long-term outcomes for the client?
yeah, I totally agree. And then this puts more confusion amongst parents because they may go to their primary care practitioner, say a
Yeah.
GP, and the GP will say, "Oh, it's okay. Your son's not crawling at 9 months
Yeah.
or 12 months. That will happen in due course." And I'm sure yourself and many of your
Yeah.
allied health practitioner colleagues would say that maybe that was not the best decision there. Maybe we should have come in a bit
Yeah.
earlier and checked that out.
Yeah.
So,
Yeah.
but
Yeah.
yeah, look into it. It's interesting how they shifted that
Yeah.
that goalpost by a good number of months and many of the milestones, which I don't think was a great thing to do.
Yeah, as a speech pathologist, and I can agree that any speech pathologist listening, nothing frustrates us more that when these parents go to a health professional for their concerns and say, "Oh, my child's not talking," and they're dismissed with the comment, "It's okay, your child doesn't need to talk till 3. It's okay, your child doesn't need to do anything till later. Don't worry about it." And it really dismisses what we do as health professionals, because communication isn't just about words. It's all about the earlier skills: attention, turn taking, imitation, understanding, all before the words come about. So any parent listening to this podcast, if you feel in your gut, which we'll also talk about today, Dr. Carlo, if you feel in your gut something is off, please seek additional opinion or recommendations to see what is going on with your child.
Yeah, and look, it's always a fine balance between being hyper vigilant and
Mm.
being, a Doctor Google, so to speak. But this is a really important stage in a child's life, as
Yeah.
all ages are. But there's a critical window in which brain develops, and when it's not getting the foundation and the basis of what it needs, more often than not, that's a motor response, a motor
Mm.
development, whether it be oral, whether it be fine and gross motor skills, whether it be ocular, whether it be many other aspects. There, this is not one that you want to sort of pause and wait months, if not
Mm.
years, to look at. An early assessment is valuable, in my opinion.
Yeah, absolutely. 100% agree. Now, from a mother's lens, Dr. Carlo, as we said earlier, the idea of chiropractor, as some people would believe, is about manipulation, putting things into place, and so forth. As a parent who possibly will have a child with special needs, they're quite vulnerable. They're coming from a place of fear, and also a sense of desperation because they want to access another service or a better service for their child. What what's something you can tell a parent when they approach you for an assessment to give them a sense of certainty or even reassurance with what it can be done for their child with your service?
Well, that's a great question. We believe of a premise of uh, symmetrical fluid movement is really the basis of which the brain absorbs and uses to develop higher cognitive, emotional, and physical aspects. And if that body movement is not working well, if the feet are flat, or the hips are rotated,
Mm.
or there is a scoliosis, or there is an abnormal gait pattern, or abnormal restrictions in the neck, and this can happen through injuries as a child, birth itself, um,
Mm.
posturing, feeding on one side and not the other. I mean, there are so many physical constraints that a child and baby is subjected to, which are all normal. These are all things that happen, but that can be excessive. That can be asymmetrical, meaning one side potentially is more favored than the other. All this mechanical asymmetry load will and often does have a bearing on spinal muscle joint function. And what I tell parents and what I teach practitioners when I teach them is that embedded in your muscles and joints are all these receptors, what we call proprioceptors, that tell the brain what the body is doing in space. Now, if the joint is restricted or there's an unevenness or there is some mechanical challenge with that child, as there often is, then the brain is not going to get that symmetrical fluid stimulation from the joints because of this asymmetry. That asymmetry can contribute to some neurological compromise and imbalances as well. And so what I say to parents when it comes from a mechanical point of view through a chiropractic lens is ensuring that a child's spinal, peripheral joints, feet, jaw, shoulders, and all the other joints are moving as freely, as evenly as possible is a blessing and something that we should be working towards. Now, how we go about doing that, again, is typically age appropriate. The amount of force and energy you need to use with a child, particularly a younger child, is remarkably small. And the frequency at which you need to do the therapy is generally on the minimal side because the body is so remarkable at changing that you give it a few little instances of movements and therapy and things can change quite quickly. So I would say to a parent, don't, stop watching those YouTube videos of what people think
Or
happens.
TikTok.
TikTok, it's just not what happens. There's some very gentle mobilization type of therapy, some cranial work, which works on various parts of the neck, jaw, and head. And we're working with the child. We're often, helping a child's body move as it's intended. Is it the answer for all conditions? Absolutely not. And I want to be the first to say that. It is an important part, but it's not the only part. Often it's difficult to say the effect. It could be small, and at other times it could be significant. A good chiropractor should be able to work with a parent and a child with objective goals in an evidence-based way, looking for markers of function to see, okay, we're going to do this, we expect to see this. If we see it, great, we continue. If we don't, stop, why not? Let's look at something else. That should be the way that not just chiropractors, but other therapists
All health professionals should go. Yeah.
Exactly.
Yeah. So fascinating. I find your industry incredibly invigorating, and I feel it's like, I don't like to use this word, but it's like it feels magician-like. It's because it's not black and white. There's so many avenues that you can definitely go down to understand what's going on with a child. I'm particularly interested in, and I believe this has a particular buzz at the moment, vagus nerve and gut health. Now, can you give me a dummy's guide, please, with reduced jargon to
Sure.
understand the importance of vagus nerve and a child's gut and how supporting a child's gut can support their overall development too?
Great question, and one that I love having a chat with parents about as well. Before I get to the vagus nerve, I'll step back a little bit. And most people are aware of what we call the autonomic nervous system. The autonomic nervous system is the part of the brain that, as the name suggests, it works autonomously. It's not conscious. It's the part of the brain that controls things that we don't really have to think about to help us survive. Heart rate, blood pressure, sweating, pupil size, muscle tension at times, bowel movements. All these things are generally autonomic. I eat something, I don't have to actively try to digest food. My autonomic system does it by itself. Now, with the autonomic system, there are two parts to it. There's a sympathetic nervous system, otherwise known as our fight and flight system. And then there's our parasympathetic system, which is our rest and digest. Most people are pretty familiar with the fight and flight. To be fair, I think most of us sit in that space, particularly if you're a parent. It's what it does is it prepares you and helps you react to a stressful environment. Could be danger, could be otherwise. So with that, our pupils dilate. Our heart rate increases. Our blood pressure normally increases. Blood moves to our limbs, so I can run and get the hell out of here if I have to, right? And as a result of that, blood moves away from the gut and typically away from my brain, because the last thing I need to do is think about what I'm going to do tomorrow if all I need to do is get out of here real quick. Okay?
Yeah.
All you need to think about is if something happens, think of an incident where you get scared or you're in a car accident or anything like that. You know what happens. You start sweating. You start your clarity of thought. You're really thinking about just help me survive because I'm in danger.
Yeah.
You're not thinking about digesting and bowel movements and anything like that. It's just survival mode. Okay. The opposite to that, which is that rest and digest, is exactly the opposite. Pupils constrict, heart rate reduces, blood pressure reduces, I'm more calm, blood moves away from my limbs and moves to my tummy so I can digest food, and also moves up to my brain so I can think clearer, I can process things, I can be more rational, all the things that we want. Now, we want both things at different times. Let's be fair, right? If I'm getting attacked by someone, I don't want to be sitting there going, hey, this is cool and relaxed. I want to be, where's the exit door? I want to get out of here as quick as I can, right? So it's a time and place for both. But it's fair to say that, and certainly in our office, in the cohort of adults and children that we see, many of them sit in that high sympathetic, high fight and flight state. Now, go back to the vagus nerve. The vagus nerve is probably the most dominant nerve of the parasympathetic system, of that rest and digest.
Yeah.
So the vagus nerve is a nerve that comes out of our brainstem, which is the upper part of our neck, lower part of our brain, and it facilitates gut function. It lowers our heart rate. It puts us more in a calm state. It changes our blood flow and so on. So we synonymously link that rest and digest with the vagus nerve. So I've done that preamble, so we've got a picture of where
we needed that. We need that. Yeah.
Great. So the vagus nerve, particularly if you assess it, we could talk a little bit about how we assess it in our office, but when you assess it properly, for most people, it's sitting relatively low in function relative to our fight and flight state. Okay.
Yeah.
Now, when that happens, as I said, the vagus nerve innervates a lot of our abdominal area, our chest area, particularly our gut. By innervating our gut, it has so many different functions. Vagus nerve secretes a lot of the enzymes that we use to break down food.
Yeah.
It helps what we call gut motility, or in other words, it just helps matter in our gut move through so we can pass it out, right? So constipation is an example of low vagal tone. Okay. Enzyme secretion, gut motility, acid secretion are also part of the vagus system. And also we have in the lining of our small intestine these cells called tight junctions. Basically what they do is they make a very impermeable barrier that undigested food, cannot penetrate. When we have low vagal tone, that tight junction separates. And so we can get undigested food like proteins, gluten, casein, and so on, which are found in dairy and dairy products and bread products. These products can get absorbed into the body undigested. And then that's when we get things like leaky gut syndrome,
I was going to say like
When we
diarrhea or leaky gut.
leaky
Yeah.
gut, we get food sensitivities because now our immune system, which is located in our gut, is going, what is this food
What's going on?
coming across the barrier that's not digested? It's a foreign object. And
Mm.
then the body can have an autoimmune response. And that becomes a whole host of other issues that some people get as well. So vagus tone and gut function are linked, are the same.
Yeah.
The other factor I should say to you is the vagus nerve is highly involved with the immune system.
Yeah.
And 50 to 70% of your immune system is located, guess where? In your abdominal area, in your gut.
Yeah. Yeah.
So
Yeah.
again,
Yeah.
low vagal tone, apart from all those digestive things that I mentioned, also has a significant impact on your immune system. Now, tell me a child that's
Mm.
neurodivergent at some level that doesn't have a gut-related, an inflammatory issue.
So many.
So many, so many.
So
Now, look,
many.
and I'm being broad here. I'm not saying that this is
Yeah. Yeah. Yeah.
this is the answer for every child, but many children that we see have a very heightened startled reflex, otherwise
Yeah.
known as a Moro reflex or a fear paralysis reflex, which are these primitive reflexes which we can talk about soon.
Mm.
And when they're in that startle response, they've got that high fight and flight, low vagal tone, gut gets
Mm.
affected, immune system gets affected, and unfortunately, tackling it from the gut perspective only, taking supplements and changing diet, look, there's merit there. But now we're looking at a brain-based issue rather than a gut-related issue. And tackling
Mm.
it from a gut with a gut-related strategy is not always going to be particularly helpful. So we can both identify and help manage vagus nerve function in kids and in adults. And by doing so, we set the foundation for, you know, avoiding a lot of those things that I mentioned, increasing the
Mm.
immune system. And when you get those two things going, you're miles ahead of where you would be otherwise.
Yeah. It's so fascinating. You were talking about everything being low, like a low immunity, low metabolic concerns, all of that. But then in my mind, I'm thinking when a child that I'm working with, when they're not feeling well, they're not engaged or reduced engagement, inattentive, highly sensory, reduced participation. So when we're looking at how we're going to support a child, let's start at the gut for one part and let's support them and their vagus nerve function to then holistically support the outcome for the child.
I think you're exactly right.
Mm.
With those type of children that are highly sensitized, have a fear response, and would hide under the
Mm.
parents' legs and chair when they're
Highly
coming into the
anxious.
room, highly anxious. So think of
Mm.
that highly anxious presentation, and many parents
Yeah.
would go, "Yeah, that's my child." We look at it again from a hierarchical point of view. We look at it in terms of what we call primitive reflexes.
Yeah.
Um, and for those of you that don't know primitive reflexes, they're inborn, natural, innate reflexes that we are born with to help us survive. Where, unlike any other species, humans are born with a brain that's very significantly smaller compared to our body mass, compared to any other species.
Mm.
Part of that is because mum's pelvic rim is generally relatively small and doesn't allow that expansion. So we're born with underdeveloped brains.
Yeah.
But to help us survive, we need these primitive reflexes that allow us to survive. The grasp reflex is one, the startle response is another, the suck and rooting
Track
reflex,
breathing
the
flex.
spinal
Yeah.
gland. These are all these reflexes that we're born with. And in those first 3, 6, 9, 12 months of life, as our brain develops, these reflexes start to inhibit or they start to integrate and are longer
Mm.
present. But many of the neurodivergent kids that we see, that for various reasons, these reflexes are still present. and they could be present well into someone's teenage years. If
Can I
that
interrupt you? How come?
Yes.
Sorry to interrupt you, but how come?
It's a great question. I don't think anyone has the answer, but I can give you, just based on hundreds and hundreds of kids that we've seen, a common thread. Sometimes, and in no particular order, and I'm not saying one is more important than the other. Definitely birthing can make a difference. A lot of these reflexes are initiated during the passage of a baby through mum's pelvis. So, when we're having C-section, and again, I'm not here to judge anyone. If they need it, they need it. But we're certainly seeing more C-sections now than we would, say, 20, 30 years ago. So birthing and the intervention that's required could be part of it. Again, breastfeeding seems to be on the lower end than what it would normally be compared to historic. Missing a lot of the kids' milestones. We would put them in artificial sitting devices or standing devices, and bamboos or walkers and things. And that's another topic that we could probably leave for another time. I'm certainly not a big fan of those because they hasten the change in a very inappropriate timeline for kids. So, we see a lot of these early milestones that get missed, and we say, "Oh, that's fine. My son didn't crawl but walked at 9 months, and so I'm so proud of my son doing that." But no, we want him to crawl. Crawl's so important to a child's development. And then you've got the environmental aspect, and you've got there's so many different things, and
they are.
It's hard to say, Rita, which of those, but generally it's a combination of those things that we see the retention of these reflexes. That's just from empirical evidence. That's what I see. But it's generally when I go through a parent's history about their child, they're normally saying yes, yes, yes to a number of those things. And it's not uncommon to see that history in a child that has a retention in these primitive reflexes well beyond what you would expect of, well beyond a 3, 6, 9 or 12 month time period. So the two reflexes that are in question here that relate to the vagus nerve is that Moro reflex, or that startle reflex. Most parents would be familiar with it. If you made a loud sound around a baby. And the baby will get startled. You shine a bright light in their eyes, or you quickly move the baby. There's a very stereotypical movement of the head and arms and body arching back. That's the Moro reflex. And again, in a 3-month-old, 6-month-old, we expect to see that. But with many kids that we see, particularly those that have got anxiety, that hide under the chair, they're very reactive to things, that have a strong fear response, this reflex, as well as the fear paralysis reflex, is still very, very dominant. And what I say to parents is that unless we work in integrating that reflex, and that includes vagus nerve therapies and other things that we do, your child's going to be in a very reactive state. And it makes it difficult for development therapy to really take hold, because, for lack of a better description, the child thinks they're under threat. No matter how much we may go there and say nice things and do nice things, if their brain is wired in a way that they're perceiving things as a threat, again, those frontal parts of the brain and higher parts of the brain get shut off because blood flow reduces when they're in that fight or flight state, as I mentioned before. And so their rational thinking about how I should be doing things or reacting or learning new skills through therapy is going to be limited because they're in that state. If I'm anxious and I'm fearing my life and you're trying to teach me how to do something, I can tell you now, I'm not going to be very receptive to what you're going to share with me, right? And the kids are no different from that. So when we discuss that with parents, I think the penny drops and go, oh, wow, that makes sense. So one of the things that we start with is really trying to wind that system down, calm it down, And there's different ways in which we do that. But once you do, then a child is more receptive to taking on board therapy, learning, academic, behavioral therapies, or whatever it might be. They're going to be far more receptive to that.
And their diet also changes too, like they're more open to trying different variety of foods.
It's not by accident that we see that.
Yeah.
And obviously, once they're starting to eat better, the calorie intake, the nutrition range increases. They're eating less of the starchy white foods, as many kids tend to eat.
The beige
And
diet.
and then they're getting their vitamins and their supplementation into their body, and that has its own positive effect as well. So sometimes we start with the basic foundation, particularly when we have these kids that are so wired up and anxious. We want to down-regulate that as quick as we can.
Yeah. So fascinating. I love this stuff. I know it's just something we all need to know about, especially when we're questioning, how can I help my child, if you have unanswered questions as well.
And that's, you asked one of the early questions about why did I get into the neurology space? It's again, when you understand the connectivity, you understand how one area of the body relates to another, and how if I do something here, it's going to have an effect here. That's pretty cool. You then have a huge array of possibilities that you can both assess and help manage a child using a very evidence-based, science-based approach, but maybe in a novel way. And I think that probably sums up a lot of the work that we do. Certainly not conventional in terms of what is typically performed, but if you look at it, why we do it, and the tools in which we use, it makes sense. And I just gave an example there of the vagus nerve and the brain-gut connection. And if you understand that, then you can start to think about, well, if I do this to the brain, I regulate this, then chances are my gut and immune system is going to improve as well. And sure enough, for many it does.
Yeah. Fascinating. Really, really interesting. What age range of children do you see?
So we see kids. I think the youngest we've seen is probably a child about 3 months. Now, to be fair, that's a child of an existing patient. Mum was concerned, obviously, as you would expect. Would you mind checking the child? But look, typically, when it comes to therapy, we have children 12 months, 15 months of age, all the way up through, to grandparents and so on. So we see a range of people through that age group.
Wonderful, wonderful. Now, another buzzword that's been floating all over my social media the last few months, and maybe that's just because all the research I'm doing with my Wine with Wita content. Dr. Robert Melillo, is that how I pronounce his surname?
Melillo is correct, yes.
Yes. And I saw you just came back from America and you worked with him. You did a course. Please explain to the listeners, what's this Melillo method? And let's talk about the method right now on the podcast.
Definitely. So Dr. Robert Melillo is a person with similar credentials to myself in that he's a chiropractor by profession. He's done functional neurology or clinical neuroscience postgraduate degrees. He's completed a PhD in paediatric neurodevelopment. But where he excels, unlike anyone else, is really his research. He's written, I'm going to say 40 plus papers, but I could be underestimating that, in fact. And they're all peer reviewed. Please do a PubMed or a Google Scholar review on Robert Melillo, Melillo, and you'll see the huge amount of research papers showing evidence and support for what he's been doing. So he's written many textbooks and fantastic novels written really for parents to understand the disconnection that many of these children have. And he talks about disconnection as the premise of a lot of the underlying issues with children. And the way I describe it is similar in that for many kids, it's not a hardware problem, meaning if we did an MRI or a CT scan of a child's brain, it would look no different from any other neurotypical child. But where the differences are is that software, the connectivity between different areas of the brain. And I describe the difference between a hardware problem and a software problem. One's got a glitch, another one's got a mechanical issue. And for most kids, it's the glitch that's the issue. And his books and his work is all about evaluating and treating this disconnection. And he does it in a very beautiful to follow, easy to understand way. His textbooks are written for parents and they can get a lot out of it.
Easy to read.
Easy to read. He's got a lot of podcasts. He's all over the social media network, as you say. And I'm very fortunate to be closely related, professionally related to him. We've brought him out to Australia several times over the last few years. I've been to the States probably 5 or 6 times over the last couple of years. And I was just there a week or two ago where we both taught a 3-day conference. And then I spent 2 weeks in his office, his Manhattan office, where, it was a very immersive training program that I spent with him and his team. And we're one of few practices or clinics in the world that are certified at the highest level in his method. So it's a very functional approach. It's a very when parents read the book and listen to his work, it makes a lot of sense in understanding. It's not a labels. It's not like, well, you have this condition, so we must do this. It's about understanding and evaluating development. It's looking at these primitive reflexes that we spoke about. It's looking at brain asymmetry. We have a left and right hemisphere of our brain. And at certain ages in our life, one becomes a bit more dominant than the other. It's just a normal development that occurs. But for many kids, at least neurodivergent kids, we see the asymmetry between this brain function to be exaggerated or quite significant. And it's that difference that is another layer to the qualities that we see in many of the children. And look, I'm the first to say that there are incredible traits and skills that any child, whether they're ASD3 or anything, or have that diagnosis or any other diagnosis, they have incredible traits, incredible brilliance, but they also have incredible challenges as well. And he, in his book, recognizes this uniqueness, and it puts a very different perspective and a lens on understanding why this occurs, what it looks like, and what you can do to help. And his book goes through, obviously an abridged, home-based version, but as a clinic, we offer a far more tailored, bespoke way to help children using his method.
This method is somewhat of an intensive that a child has to obviously you have to assess the child and determine what needs to be done, but is it typically an intensive type approach?
It is, and it's an approach that we've been adopting now for a number of years, and it is. We paralleled many years ago a more conventional treatment approach, which is say once a week, to an intensive, and I'll describe what intensive looks like in a moment. And when we compared the two, they were chalk and cheese. They were so different. And now we have parents calling us saying, I want to see you because of the intensive. I want these results to happen quick. And neuroplasticity, the ingredients that are required for neuroplasticity is frequent, short, tailored, but incremental dosages of whatever it might be, in this case, therapy. So we do multiple sessions per day, and we do them 4 to 5 days a week. So we do a therapy session. We have a break where we offer oxygen and red light therapy as a way to consolidate the first session, but also get the brain ready for the second therapy session. and then we do a second therapy session straight after. So we do this intensive treatment model, and then we repeat that daily for 2 weeks. And then we scale that down over the next 6 weeks. And we find, and this models Dr. Rob Melillo's method and many of our colleagues in the States, that intensive models make huge gains in a short period of time. Now, it's not without its challenges, obviously, an investment in time and resources, but by far we find that to be a fantastic, efficient way to accelerate changes and get the ball rolling, and then other modalities can come in on top of that and take advantage of those early changes that we've set.
If parents want to get their child to see you or even complete this method, what's the best way to contact the Brain Hub?
The way
do you have a waiting list?
We do.
Everyone wants to know that, yeah.
We do have a wait list, and it can be quite lengthy at times.
Yeah.
But we do have a big team and an expanding team that's working on, at the right level, support as many families as we can. The first step is we direct people onto our website so they can complete what we call a Get Started form. It's an opportunity to talk to me for 15 minutes. So every new patient in the practice, I talk to them first. I want to vet them to make sure that we're the right clinic for them, and that they're the right candidate for the work that we do.
Yeah.
We have many patients that travel. In fact, 50% of the patients that we see come from outside of Sydney. We have people from interstate most weeks. And if someone's going to invest that sort of time and resources into us and into their child, I want to make sure that they're getting best value for it. And so we do this Get Started call that sort of sets the tone, have me understand a little bit about where they're at, what's worked, what hasn't worked, talk about what we do, and then see if there's a match there. And then from there, we then set up an initial appointment, go through our assessments, depending on the function and the capacity of the child. Our assessments can be an hour and 20 minutes all the way up to 3 hours.
Wow.
We have a lot of diagnostic tests that we can do to set the benchmark, get a good understanding of what our metrics are when we start, and obviously an opportunity to work towards improving them and review them at a later stage. But some of those assessments are very age dependent and capacity dependent as well, as you can imagine.
Yeah, absolutely. I agree. I will put your contact details for your clinic and social media accounts in the show notes, as well as on the social media platforms. But Dr. Carlo, it has been an absolute pleasure having your wonderful insight on Wine with Wita this evening. I am sure, without a doubt, it will support many families and open up their eyes and ears to different ways that they could support their child's development, as well as supporting many health professionals that listen to this podcast. Now, Dr. Carlo, before I finish up, I always ask my guest, if you were to be a better version of yourself tomorrow, what word will you apply to yourself today?
What word would I apply to myself today?
Yeah.
Respect.
Respect. That's the first.
Respect. Yeah, I think respect. And that, if I could expand on that, it's respect
Yeah, of
yourself.
course. Yes.
I think honor yourself and respect yourself. Give yourself what the body needs in terms of health or nutrition, sleep, time, whatever that might be. Respect others around you, and that includes your family, which I'm sure we could all do better at. And I'll be the first to say that. Our colleagues and others, and really, I think respect, in my case, in your case as well, respect our patients. I think I learned so much from them, and I'm so grateful of the opportunity to work with them. So certainly, I think respect is the first word that comes to mind. I'll probably sit on it later at night in bed or lay down and think about it and go, oh, I probably should have said that. But
No, I
But
love
respect would
this
probably be
word.
the
I
word.
love that word. Thank you. Thank you for sharing that. And it's so true. Respect yourself, respect your family, and respect health professionals. And I love how you also said respect our clients, because they teach us so much on a day-to-day basis.
You bet.
And
100%.
it's a privilege to walk hand by hand with these families and guide them on their child's intervention, as well as working with health professionals like yourself to ultimately create the best outcomes for our clients.
You bet. 100%.
Now, for everyone else, I hope you enjoyed today's episode and learnt something incredibly useful. Another episode of Wine with Wita will come to your ears next week. Thank you, everyone. Thank you for tuning into another episode of Wine with Wita. I hope you found some new inspiration, learnt something new, or gained a fresh perspective. If you enjoyed this episode, I'd be so grateful if you please leave a 5-star review, as it really helps the show get in the ears of new listeners, plus it takes 5 seconds. If you're keen for more strategies and insights, then head over to Instagram and follow RS Speech Pathology.